I want to discuss the nursing crisis that's affecting the quality of life and healthcare costs across the country. Why do you believe America has a nursing shortage? And how is the shortage impacting healthcare costs and quality of service patients are receiving?
So I would say that the nursing crisis is a cyclical thing. You don't have enough professors, right? Because you don't pay them well. Nursing professors, you don't pay them well. And if you don't have enough professors, you cannot accept more students. So you graduate the students that you graduate them, and they go into the field. And, it can be. So, by the way, I am a family nurse practitioner. I started out my career as a critical care nurse, worked in the ICU for several years, worked in the cardiothoracic unit for several years, and got my leadership chops, if you will, from working as a hospital administrator. So the nursing crisis is a real thing. The nursing crisis absolutely affects quality and safety. But when you think about it, again, back to that cyclical cycle, you don't have enough nursing professors to teach nursing students. Once you have those nursing students that graduate, they go into the field and they are burnt the hell out because there aren't enough nurses there. Then you have multiple people leaving the field. Some will say, is it, well, increase salaries. Salaries is not it, right? Because people, after a while, if you're a nurse, you love your job. You do the job. You want to be paid well. You want to be paid as, acknowledgement of what you're doing. But I think the biggest reason why there's a nursing shortage is because nurses are counted as an expense in a hospital setting rather than a value add. And so physicians in the hospitals have RVUs. They're counted, they are budgeted in a way that accounts for their value. We, as nurses, are only accounted for as an expense. And so the first thing everyone does is when you see that you're about to go over budget or you aren't going to hit that 3% margin, you cut the nurses.
Sounds like teaching in a way. It's pretty bugged out. It's like the same thing. Please explain how the shortage is impacting the quality of care people are getting. Because I had a nurse tell me in private that, what she say? I can't use the word that she used because she was cursing. But basically she said, if you don't have to go to the hospital, don't go.
I think that's a bit harsh.
Yeah.
I would never suggest that someone not go. I would tell them to research where they're going and go to that hospital. But if you need to go to a hospital, go to a hospital. But I would say that it impacts safety because we have professional organizations. Nurses have several different professional societies, professional organizations. I will use A1 as an example, the Association of Women Obstetrics and Neonatal Nursing. And then I can go to ACCN, which is critical care nursing. A1 says if you are a labor and delivery nurse, you are only supposed to have 2 patients.
That's it.
Period. If they are in active labor, you're only supposed to have two patients.
That makes sense.
If you're short of nurses and you have 4 laboring people on the unit and all you have is 1 nurse, maybe a charge nurse and somebody in triage, meaning nurses, it's too much.
Too much.
And so that's how it impacts quality and safety.